This is an open video submission by a doctor on behalf of the entire people of the country to Shri Narendra Modi, the Prime Minister of India, and to all the other cabinet members, to all politicians watching this video. As the country is struggling with the COVID crisis, who's to be blamed? Yes, I come from the anti-China sentiment. I would definitely agree there is a conspiracy. Who else? Many would say the government didn't plan, the government didn't forecast, the government didn't anticipate. But I would not certainly concur with that thought. I would probably say it is the carelessness of the people that does play a significant role in the spread, because each one is responsible. Even with the oxygen supply not meeting the demand, remdesivir shortage, and even the vaccination shortage that is currently huge, I would still not probably blame the government, because there are so many things that's beyond the control of the government. But where could the government have done better? Over the years, investing in public health infrastructure, incentivizing the doctors who are working in the public healthcare system, so that the public healthcare system is very strong, like many other countries. So something like this, like a pandemic happens, the public is in a strong position. The public infrastructure system is so strong that they can support, which has not been done. Or how can it be done when India has spent only approximately 3% of the GDP every year? How can it is possible? Already with the GDP being one of the lowest in the whole world, with 3 to 3.5%, what is possible? All this is possible. As against a country like United States, where it is 16.9% of GDP, or a comparable country like Brazil, which is about 9% of the GDP is spent on public healthcare system. We haven't. So automatically what happens? The private healthcare players fill up the gap. And we know very well, at least through this COVID crisis, it is majorly by the private healthcare system that has taken care of the patients who have suffered from COVID, or taking care or will continue to take care. But what has the government helped or incentivized this private healthcare system? I'm not sure even many doctors know these facts. In fact, private hospitals are treated in par with cinema theaters and malls in terms of electricity usage or the payment that they do, which is highest slab of electricity. So basically it means walking to a cinema theater and a mall is as good as walking into a hospital. That is the message that it takes. We all know about GST. The government is always meeting its GST targets. But you know where the GSTs are coming from? From the medicines that all of you are buying. Starting from your paracetamol to the important life-saving drugs like remdesivir and steroids. What used to be 5% earlier is 12% GST for every single medication that's been used. Once you've recovered out of a COVID, when you go back home, the doctors would give you multivitamin tablets, protein supplements to improve your muscle mass, which is charged at 18% GST. Why should a government earn out of a suffering, earn out of a pain? However, hospitals who are doing service are not supposed to collect GST from the patient for the service that the hospitals do. But they have to pay all their GST to buy every single equipment. How are they going to match this cost? Does the government pay back these GSTs to these hospitals? No. The next thing is insurance. Why do any one of us take insurance? To help us when there is an unexpected emergency like this. So basically, anybody who has an insurance should be covered completely. But what is really happening? At this point of time, most of the insurance claims submitted by hospitals are being denied, leaving the mercy of patients to pay for their bills, or at the hospitals to reduce their bills or to support the public. So it's the doctors and the patients are helping each other. Nobody is really coming to the help. Forget private insurance companies who work only towards profits. Even the public sector insurance companies are really not come to the help. There is something called GIPSA, which is basically a conglomerate of the public healthcare companies who work with a monopolistic attitude, who hardly cover, who have not really increased any of their cost in spite of the COVID over the years. Even they are working towards profitability. Public sector companies, so basically they're earning for the government at the mercy of the patients. In fact, many of you would be surprised to know the treatment at this point, the insurances does not cover the PPE kits, the masks, etc. They call it disposables and they don't cover it. So basically, they're expecting the doctors to treat you without even a mask. So that is the current situation for many of you watching this. So why will any doctor have to really work, both in the public sector, in the private sector, risking their lives for what? What is incentivization? This may look as if I'm a doctor supporting the doctor. Yes, partly. Okay, leave alone the doctor. Let's come to all of you, the public, the people. We all know the vaccination drive is on. All of us have to be vaccinated. When every country in the world, including the countries that India had diplomatically supported with vaccines, have been vaccinating their public free of cost. But still, India charged 250 rupees. It wasn't too high, so probably many didn't complain. But what is the current situation? We have left the states of the country at the mercy of the vaccine manufacturers to decide their own costs. So they have to procure their own. They have to negotiate the deals, and you have fixed the cost. And nothing against Serum Institute or Mr. Adar Poonawalla. They have done a great job in bringing vaccines to the market. But now, reading yesterday's news that as a philanthropic gesture, he's reducing the cost of the vaccines from 400 to 300 for the states. What does it imply? You have left the states and the people of the states begging at the hands of a corporate. Why do we need a government? To help us, to support us at bad times, be it floods, be it drought, or pandemics like these. But if you are earning out of the people, earning out of the doctors, without any support back again, then what is the government really doing? Policies that we doctors and hospitals can do way better. I've always been an ardent follower, admirer of you, Shri Narendra Modi ji, and your entire cabinet. But collectively, bringing the pains of all the doctors, the suffering of the public, I fear no more.